Hi, I'm Sophie, and I'll be doing a newborn assessment for you tonight. And this is Carrie. Carrie was born to Patricia, a 30-year-old female, Para 1, Gravida 1, and no smoking or drinking history during her pregnancy. And the father is very much involved. They are really happy. And she kept all her prenatal visits, and she was able to take all her prenatal vitamins, okay? And Carrie was delivered through a vaginal birth and approximately 5 hours ago. And her first APGAR score was a 9, and her second APGAR score was a 10. Um, and Patricia is at bedside. I have already identified Carrie, and Patricia does agree that Carrie is her daughter, and their armbands match. And I am going to do a physical head to toe assessment on Carrie. Okay, we're back with Carrie. Generally, looking at Carrie, Carrie looks like she's okay. She's a normal baby, and her skin is nice and pink, and she's crying. She's kicking like a normal baby. She looks all symmetrical, and I already took her vitals. They are all within normal limits for her. And now I'm gonna check her weight on the scale. I'm gonna pick her up and place her on the scale with a sheet protecting her, and it's already zeroed out. Okay, got Carrie back. And now I'm gonna measure her height. Her height with her foot elongated. Okay. That's wonderful. And while I'm at it, I'm just gonna measure her head circumference. Okay, that's really good. And her skin color looks nice and pink, and her her head looks all symmetrical. Her trachea is all nice and midline. And I'm gonna check her fontanelles, her anterior and posterior fontanelle. And yes, I can feel the pulse. It's not flunking, it's not bulging. And I can feel this one and the same thing. Now I'm going to assess Carrie for head lag. I'm just going to pick her up by her hands, and not really doing it, but her head is going back. And next, her eyes. Her eyes are nice. Her sclera is all nice and white, and her pupils are nice and round. And I'm gonna check if they are reactive to light. When I shine the light on Carrie's eyes, they are reactive. There you go. And her ears, they look symmetrical. And I'm gonna use the otoscope to look into her ears. And I can see the tympanic membrane, and it's all intact. And same on this side. And now I'm going to assess Carrie's nose. Her nose is nice and pink and moist, and her lips are symmetrical, and the inside of her mouth is intact and nice and pink. And her chest is rising up and down, and she doesn't seem to be in any respiratory distress. And her nipples are nice and formed right here, very nice and symmetrical. And if I could sit this down, I'm able to assess her brachial pulses and femoral pulses. Okay, and her abdomen looks nice and round, and I'm going to listen to her bowel sounds in all four quadrants, and palpate her abdomen. With my stethoscope already cleaned, I'm going to listen to her bowel sounds. I heard bowel sounds in all four quadrants, and her abdomen is moving with her diaphragm very nicely. And when I palpate lightly her abdomen, it's nice and soft, and it doesn't seem like it hurts her. Now, her ankles and her wrists, they look like they are able to move freely, and they have full range of motion right here. And in doing Artolami's maneuver and Barlow's maneuver, I'm able to place her feet flat and push her legs back a little, and she's able to tolerate that very well, and her hips move nicely. Now, I'm going to check Carrie's reflexes, and the first one is the rooting reflex, where I stroke the side of her face, and she is able to move to her face that side. The second reflex, with the glove finger, I'm able to put my finger inside Carrie's mouth, and she is able to suck on my finger, which is called the sucking reflex. The Moro reflex is when I make a noise next to her, and Carrie is very much startled. And the tonic neck reflex, when I turn her head to the side, and her extremity moves to that side also. And the Palmer reflex, where she is able to grab my finger when I place my finger inside her hand. Then I'm able to lift Carrie up so she could do the stepping reflex, where she's able to put one foot in front of the other. And lastly, I am going to assess the Babinski reflex, when I stroke the bottom of her feet, of her foot one at a time, and her toes are able to fan out. And now I'm going to check her genitalia and her buttock. When I assess, and Carrie, yes, she's a female, and her labias are nice and pink, and no issues there, and I don't smell anything, no odor coming from that area. And when I assess her rectum, and with a gloved finger, I'm going to put one finger inside her rectum, and I can feel that it contracts properly, and there is an opening there. And this concludes our head to toe assessment with Carrie. Thank you for watching.